there's a lot of discussion about how VO2 max decreases as individuals age. I often wonder, is this also related to muscle mass? Are there changes that we anticipate for an older individual, or can those be mitigated based on their activity level in general?
Yeah, the most common metric that we measure, and arguably the most common, probably inarguably the most common metric looked in the literature across ages, different types of interval training, is cardiorespiratory fitness as objectively measured with a VO2 max test. And that's, as you allude to, because it's such an important marker of health, risk for direct correlations, between risk of dying from all causes, risk of developing type 2 diabetes, cardiovascular disease. And so if you can enhance or maintain your cardiorespiratory fitness as long as you can, that's generally a good strategy. And interval training can be a very effective way in order to do that. You alluded to sarcopenia. I think there could be a really good debate around, if you could only do one, do you want to try and enhance cardiorespiratory fitness, or do you want to try and enhance muscle strength as you age? Clearly you want to do both. And that's where I think functional style, high intensity interval training can be very effective because you're getting the strength benefit, especially lower body strength, depending on the movements that you're using. And if you keep the recovery period short, high intensity functional training can lead to improvements or at least a maintenance of cardiorespiratory fitness as well. And we know that there's many types of interval training, including functional style training, that have been applied safely and efficaciously in older individuals. We're talking even into octogenarians. So like many forms of exercise, we can appropriately tailor it to the individual. And so, to just say that everyone can do interval training or no one can do interval training, those blanket statements just aren't appropriate.
Are there ever times where an individual, say they're relatively untrained and they're unable to utilize their skeletal muscle enough to bring up their heart rate? Do you see that?
We have not in our studies, even with some fairly deconditioned individuals. I have not done these studies, but some of my colleagues, and there is work, for example, looking at individuals with spinal cord injury, especially lower body spinal cord injury, where those individuals can perform arm cranking exercise in order to try and elicit a cardiorespiratory stress. And so that style of exercise in individuals like that can also be effectively applied. So my short answer to your question is no, we have not seen a situation where, people are unable to sufficiently activate their skeletal muscles to get a cardiovascular training stimulus.
So essentially everybody could do this.
So essentially, yes, unless there's an explicit contraindication, right? And of course, if someone is just very deconditioned, just starting out, I don't think they need to be afraid of interval training. They might not necessarily want to jump right into high intensity or certainly sprint interval training, but just that idea of hills and valleys, light to moderate alternating pattern of activity can be extremely effective. And so ideally, I think we would always suggest that people start with moderate sort of preconditioning before they start to push themselves. That being said, high intensity interval training has been applied to many different individuals. Again, I'm not a medical doctor, I'm not a cardiologist, but there are explicit conditions, unstable angina, for example, where this might be absolutely contraindicated, but it's more, I would say, the exception than the rule. For, as a general statement, can most people perform interval type exercise?
That's very valuable because oftentimes people will think about all the roadblocks to training, and nothing is more important than the physical health, really leveraging that skeletal muscle. Can you define sprint interval training and when that would be utilized?
Yeah. So again, our working definition, and I think this generally aligns with how it's often used. Why don't I start with the performance side? Because maybe it's a little bit easier there. Sprint interval training would be at a pace that's above maximal aerobic work rate. So maximal aerobic speed if you're a runner, maximal aerobic power if you're a cyclist. So you can imagine, what is the power or speed that elicits your VO2 max? But of course, you can work well above that up to what coaches and athletes refer to maximal sprint speed. And that difference between maximal aerobic work rate and maximal sprint rate is sometimes called your anaerobic speed reserve. But the bottom line is working above VO2 max work rate pace constitutes sprint interval type training in a performance setting where we're usually often aware of what peak workloads peak work rates are. On the health side, again, I would go back to this, the ACSM definition of near maximal to maximal exercise. And there we're talking, above about 91% of VO2 max, above 95% of heart rate max, 17 out of 20 on an RPE scale. So again, those are contextualized reasonable values, if you will, or thresholds for what distinguishes this particularly intense variant sprint interval training from other forms of lower intensity, high intensity interval training.
And it's very uncomfortable.
It is. There's no free lunch here, right? If you want,
you
are
not going to look forward to this session, or if you are definitely doing it wrong.
Absolutely. It's an uncomfortable form of exercise. The pace required to do it right is uncomfortable. And this is where it's really important to understand the nuance of, well, what is HIIT? What is sit? Because I would submit that sometimes, for the folks who aren't fans of interval training, and there's some vocal ones out there, of course, they will try to sometimes position interval training as only sprint type interval training or these all out Wingate type efforts and say, well, no one's going to do that. And of course, many people are unwilling or unable to do that style of training. But there's a huge range there, I think, when it comes to high intensity interval training.
Essentially, everyone can do high intensity interval training. Sprint interval training is somewhat of its own beast, right? To even know that you're reaching that max capacity.
Yeah, I think that's fair to say. And even when we say everyone can do HIIT, the vast majority of people can, and there may be some who, it's contraindicated for. But I think that's a fair analogy how you just place that.
And we discussed that the length of time, a minimum effective dose would be about 10 minutes of high intensity interval training. A sweet spot would be 20 to 25 minutes. Where does sprint interval training fall in that?
Yeah. And so when I said that, 10 minutes, those 3 20-second bursts of training are sprint type efforts, right? And so that would be an example of where, 1 minute of intermittent sprinting over a 10-minute period, we know that is sufficient to get into that elevated heart rate range. And we know that type of training leads to marked and robust increases in mitochondrial content. So again, if you're able and willing to do that sprint type effort, it can be an extremely, certainly time efficient way for people to train, but it's just one flavor.